So my name is James Neuenschwander. Everybody calls me Dr. New. I am an MD. I graduated from the University of Michigan in Ann Arbor a long time ago, 1985. I have board certifications in both emergency medicine and integrative medicine. I am a retired ER physician, and I full-time have an integrated medical practice where basically it's integrated family medicine. So about 25% of the people I see are kids, the rest are adults. Pretty much everybody has some type of chronic medical condition, and we do see a lot of kids on the autism spectrum. I am involved with Medical Academy of Pediatric Special Needs, and I am their conference co-chair, and that's a group dedicated to integrative treatment of kids. Well, the MycoTOX profile is something that allows us to measure the toxins that can be made by molds in a person's urine. So these toxins may do nothing at all. They may be just an innocent bystander, but a lot of people are reactive. So at least a quarter of the population has the genetics that make them potentially reactive to mycotoxins. So when you have a person that has multiple different symptoms and you're not really clear as to why, that mycotoxin screen is an excellent tool to use. What's important to remember, and a lot of what we covered today, was this idea that reaction to mycotoxins can cause a whole host of symptoms. So anytime you have a group of symptoms that you're kind of puzzled about, or I don't know what's causing them, or where are these things coming from, I think of mycotoxins as a possible cause. I'm in Michigan. Michigan is a very moldy state. You know, whether it's summer, winter, spring, or fall, it's always wet. And so mold is a huge problem. And again, some of these molds make these toxins, and these toxins could cause health problems. So the mycotoxin screen is an integral part of what I do in my practice. What I always like to say is you consider that mycotoxin profile anybody that has syndrome. You know, I always say fill in the blank syndrome. So chronic fill in the blank syndrome. It could be chronic fatigue. It could be chronic Epstein Barr, chronic Lyme, chronic whatever. Particularly a patient that isn't responding to therapy the way they should or the way you think they should. You always want to think about mycotoxins. You know, I got involved with mycotoxins originally because I treat Lyme patients. And there would be a group of patients, I would diagnose it, I'd treat it, they get better, everything's hunky-dory. And then I'd have a group of patients where exactly the same thing. I would diagnose them using the same criteria. I would treat them using the same protocols, and they wouldn't get better. What's the difference? What's going on? And it was really the introduction of, molds make toxins, because I knew about molds and mold spores and allergies. I really didn't know about mold toxins. And it was the introduction of that concept that mold toxins alter the immune system. Mold toxins alter the hormones. Mold toxins alter the digestion. Mold toxins alter the brain. Well, good Lord, that's what all my patients have, right? And so immediately when I have somebody that's not responding the way I think they should, I'm going to do the toxin test. If I have somebody who has a chronic syndrome, I'm going to consider doing the toxin test. And the other group, and this is a little bit more difficult to describe, but these are patients that they have mystery illnesses. So I always say at least once a week, and I've been in practice for over 30 years, at least once a week, somebody comes to my office, I take their history, what I like to say, their tale of woe. And when we're done with that entire evaluation, which is usually an hour, almost once a week, I have to say, I have no idea what's wrong with you, but we're going to figure it out. So that's the kind of patient where, yes, looking at a tox screen, a mycotox screen, is going to be very high on my list of things to do.